What up, y'all? I'm Jamie J, your go-to prejuvenation beauty guru. Welcome to Snatch Skin Beauty, a place for spilling tea and honest discussions about all things related to anti-aging skincare, medical aesthetics, and cosmetic procedures that keep our skin snatched from the inside out as we age. In this video, I'm going to be talking about my most recent Browlift experience using Sofwave. Girl, she is the newest belle of the ball in ultrasound technology for treatment of skin laxity and collagen production. She ain't your mama's whole therapy, honey. But does she live up to the hype? Well, you'll have to stick around to find out. To see my real results and hear my unbiased opinion about whether this procedure is a BOP or a big old flop. All right, now let's jump into it. A couple of weeks ago, me and Dr. Lim attended the ATX Skin Soiree. This was an exclusive medical aesthetics education and networking event in Austin, Texas, sponsored by Sofwave and other vendors in the medical aesthetic space. Here, we each got a mini Sofwave demo treatment to lift the brow area, also known as a non-surgical brow lift. Oh, there we are. Dang, we cute. A couple of weeks. So what is Sofwave? Well, the simplified way of explaining it is, Sofwave is an aesthetic medical device that uses a proprietary synchronous ultrasound parallel beam technology to deliver a controlled thermal energy to a target area just beneath the skin at a predetermined depth. And it lifts the skin based on the body's known physiologic processes of collagen denaturation, wound healing, and neocollagenesis. Collagen and elastin are two of the main fibers that make up the extracellular matrix. I can't say that word ever one time. Anyways, they're responsible for the youthful appearance of sexy, smooth, taut, young, supple skin. Unfortunately, as we age, our body produces less and less until we get into our 30s, and our ability to produce it is not gone, but we just don't produce it automatically anymore. So we have to send a smoke signal, if you will, to the body and say, yo, what up, girl? Can you throw some mo? And then we get more collagen. One proven way of doing that is through wound healing. Thus, that is what neocollagenesis is. So Sofwave sends an ultrasound energy beneath the outer layer of the skin at a depth of about 1.5 millimeters, smack dab in the middle of the dermis, which is loaded with loose connective tissues in the thin upper layer called the papillary dermis, and the reticular layer is right below that. That consists of tons of dense connective tissue and bundles of collagen fibers, which is exactly the type of tissue that we're targeting. So that energy is converted into heat at a temperature, anywhere between 60 to 80 degrees Celsius, which here in 40 to 158 degrees Fahrenheit, honey. Shit, that is hot. Okay, so collagen fibers, they begin to heat up, they lose their organized structure, and eventually they denature at these temperatures. By the way, denaturation is nothing more than changing the structure of a protein by removing or diminishing its original properties. If you've ever fried an egg or seen somebody fry an egg, you've witnessed denaturation. When the egg white is it's liquid and clear, when it goes from that to being opaque and from a liquid to a solid. There's denaturation, honey. So when collagen is heated to these specific temperatures, it will contract, and this denaturation process is the tissue damage that we are creating in order to induce neocollagenesis. Now, what makes Sofwave technology unique is its ability to target and damage this layer of tissues while avoiding many of the other complications that are related to epidermal heating observed with other energy-based devices, in that there is no thermal damage that's done to the epidermis or the outer layer of the skin. So you might be thinking, wait, what? What's the point of damaging perfectly good collagen that I already have just to make more of it? My only response is sometimes spend money to make money. It's kind of like that. It do be talking about the cost just yet. Well, all jokes aside, look, if you came to this video because you think it might be time for a little, zhuzh in the brow region, then it's safe for me to deduce that you probably aren't a spring chicken, respectively. Therefore, the collagen you do have is already partially degraded to some degree from various intrinsic aging factors that began in your late 20s and external environmental factors that we are exposed to daily. So I'm just keeping it real with you. Sofwave was cleared by the FDA in 2019 for non-invasive micro-focused ultrasound technology applied to tightening the skin of the face and the neck. And then in 2021, it was cleared for its brow lifting capabilities. Treatments take anywhere from 30 to 90 minutes with no downtime, meaning you can go for a lunchtime brow lift and put makeup on afterwards and go back to the office, which is great. Results appear gradually over several weeks or months following the treatment and can last up to a year with good at-home maintenance and skincare. Multiple treatments may be needed to achieve desired results, and treatment will need to be repeated periodically to maintain your results. My single mini treatment was very quick. I'd say about 20 minutes tops. But because it took place in more of a demo type of setting, topical numbing wasn't an option. So first I went in and I chatted with the technician, asked her a few questions about the technology and the different treatment outcomes. So after filling out some paperwork and briefly discussing my medical history, we were ready to begin. First, all of my makeup in the brow region was cleaned off and my skin was cleansed. Then an ultrasound gel was applied. She then showed me what the wand looked like and explained that because I have a history of melasma, that she would be using it to deliver the ultrasound waves adjusted to a lower intensity. The Sofwave treatment was focused in the periorbital region across the upper lid brow complex. It started with the wand adjacent to my supraorbital ridge, pressed firmly to bone, working along the brow in vertical lines on one side of my face and then repeating the same on the other side. Each time contact was made, it kind of felt like a metal spoon was placed against my skin. Then it began to heat up, and it did so into a very uncomfortable level of heat for a few seconds, followed by the integrated cooling mechanism that suddenly kicked in almost immediately. So she then went across both sides one more time, this time with the wand rotated 90 degrees to create a crosshatch pattern. Then she did a third pass on my right side because it sits just slightly below my left. In terms of discomfort, first I want to preface this with saying that I have an extremely low threshold for pain. Even with microneedling treatments, I require topical numbing and I usually allow for extra time to get as numb as physically possible. Second, the forehead has so many nerves and vessels just beneath a very thin layer of skin and hardly any fat, so it's a very sensitive area to begin with. At least it is for me anyway. And the soft tissue in the periorbital region is no different. I can barely use a simple derma roller in the areas around my eyebrows without my eyes watering profusely and having a sneezing fit with every pass. And I say all of that to say that this shit hurt. Excuse my language. It was very painful for me, and to be quite honest and frank, I'd never do it again without numbing first, ever. Even then, I'm not sure how well I'd be able to handle it in that area. That said, there were other folks there getting it done in their segmental region, and they said they could hardly feel a thing. So the pain is pretty much all subjective depending on the area being treated and the individual. Immediately post-treatment, I was a little red, but there was no significant swelling. The redness subsided within a couple of hours, and it was business as usual after that. The aftercare rules were surprisingly minimal. Basically, you're advised that you can go about your daily routine, but it was okay to proceed with my regular skincare routine, including retinol, and I was instructed to use my hydroquinone to mitigate any post-inflammatory hyperpigmentation that may result from the heat since, of course, as I mentioned before, that I do have melasma. Since the mini brow lift treatment was only focused in the perioorbital region, whereas the full treatment would have included the forehead and temples to provide further lifting of the brow, I don't see as much of a true lift as I would like, but I definitely see a noticeable improvement in symmetry, whereas before my left brow arch was significantly higher than the right. Minor eyebrow asymmetry is a pretty common problem for most people. In fact, the majority of people have one eyebrow that sits slightly below the other. But for someone like me who has a very naturally, aggressive brow arch, as volume loss and tissue changes have occurred over time, it has really influenced the placement and position of my eyebrows. And so one side in particular has got, it's extremely arched. And so I'm very happy with both of them looking more symmetrical, and yeah. Now, I will not leave my good Judies here disappointed. So here's the tea, honey. This machine is operator friendly, which is a great thing for you because it means you're not going to get injured. Quick backstory, going back to Ulthera, which is Sofwave's predecessor in the market for ultrasound technology. The reason Ulthera got such a bad rap was because it was the reason it got such a bad rap for causing injuries is because the operators were not as experienced with handling that type of technology as they should have been. Sofwave, however, is great for a medical practice because there's less barrier to entry for less experienced operators, because the machine simply won't go past a certain depth and is not going to, regardless of the person's anatomy, this machine and the technology is going to go to where it needs to be. Whereas there's a lot of variation with people's anatomies, which is why with Ulthera, you had to actually be able to read an ultrasound in order to know that you were treating the proper area. So with Sofwave, the results are reproducible in all hands, meaning they don't need to learn to read the result. They don't need to learn to read the ultrasounds. So there's no need to find some laser guru with certain educational qualifications who would come at a higher cost per hour to the practice. So this treatment can be delegated to mid-level laser technicians or even estheticians, while still charging you, the patient, a premium because the treatment is being done in a medical setting. So keep that in mind, good Judies. My opinion is this. I'm going to call this treatment BOP-ish, simply for the fact that I didn't receive the extent of the treatment in its entirety, being that it was just a demo. That said, I do think it's a bit overpriced from what I've seen online. But, look, if it's truly something that can be done annually and, produce these amazing results, then by all means, give it a go, honey. But just remember, there's no such thing as one and done. Neocollagenesis is easily induced, but that doesn't necessarily translate to mature collagen formation, as pro-collagen has a very short half-life and is easily degraded. And there's a lot of bad information online that will lead you to believe that this is some kind of magical treatment and the body just magically produces all this amazing mature collagen from thin air and it will just last a lifetime. The facts are this. Collagen isn't just magically produced. In fact, the body has to draw on specific amino acids, vitamins, and minerals in order to produce just the pro-collagen too. The inflammation phase is a huge part of the wound healing process. So telling people that they can go about their normal routine is borderline irresponsible without specifying things that can impede the body's inflammatory response. In fact, everywhere you look online, that's all you see, nothing that talks about that. It's just, oh yeah, go about your routine, one and done, just trying to sell this thing as it's like this magic treatment, which many things that could be part of one's daily routine may in fact impede the inflammatory response, thus impacting your results. Things as simple as going to hot yoga or spending the weekend at your kid's baseball tournament on super hot sunny days without, upping your sun protection in a major way. There was one study that claims you can actually take one 800 milligram ibuprofen 1 hour prior to your treatment, because it's thought that the 4-hour half-life of the ibuprofen won't impact the inflammation phase, which happens immediately, which is why you may or may not walk out of the appointment slightly red and, slightly swollen. That's because the inflammation process has set in. So again, in my non-medical opinion, my non-medical yet unbiased opinion, I just think that's not worth offsetting your results when you could simply take a Tylenol instead. Again, this is something to speak to your practitioner about, but keep in mind, whose interest is best served by you coming back for multiple treatments because the first one didn't take? Just saying. So heed the warning, my good Judies. Don't take my word for it. Do your own research. Relating to, the inflammation process and neocollagenesis and things you can do to avoid and or optimize your results. So thanks guys for watching. I hope you found this information insightful. And if you like this video, please like and subscribe and stay in the know about what's coming up next. Thank you. Bye-bye.